Hey folks, Michelle Pearlman here, gastroenterologist and physician nutrition specialist.
And I'm Amy Pearlman, urologist, men's health, and sexual medicine specialist.
Welcome to Pearlman MD's podcast.
We are going to tackle all topics related to nutrition, sexual health, exercise, and mindfulness. Stay tuned.
Hello there. Happy Sunday. Michelle Pearlman here, gastroenterologist and physician nutrition specialist.
And I'm Amy, urologist and men's health specialist. Hey, Mish, how are you?
I'm good, Amo. So we are talking about the controversy surrounding testosterone today. Amy, I see a lot of patients in my clinic who have cardiovascular disease, and they're often very concerned about going on testosterone. So tell us, why is there that concern? What's been in the journals and things like that have kind of scared people away from testosterone replacement?
You know, when we think about testosterone, wow, what a taboo topic. And when you even mention that term, I mean, what do you think when someone just mentions in regular conversation testosterone? What comes to mind?
Well, I was a bodybuilder, and I can say that in my experience in the bodybuilding industry, when I hear testosterone, I think anabolic steroids. And I see all over social media of young people in their 30s, 40s, and 50s dropping dead from a heart attack or a pulmonary embolism. And a lot of people blame the anabolic. So that's where I'm coming from. And it wasn't until I started learning from you that testosterone replacement is actually very different from anabolics.
Yeah, and the interesting thing is that we actually use a lot of the similar medications. So medications and therapies that someone who is trying to gain muscle mass would use, in the gym, some of those medications are actually the same ones that I would use in a clinic space. The main difference here is the dose. So bodybuilders who abuse these medications may take up to 10 times the doses of synthetic steroid or testosterone that we're talking about. And so that is the major difference. When you actually treat guys who legitimately have low testosterone with recommended dosing regimens, it can be difficult to actually hurt someone. So that's one of the reasons why testosterone is a very taboo topic, because people think that anyone who brings it up, that they want to get their level checked or they want to start therapy, wants to abuse it. And folks, that is not the case. When it comes to testosterone, when it comes to hormones are incredibly important. They are important for every living being, whether it's testosterone or estrogen. For you and I, our main hormone is estrogen, but we also have testosterone, and we wouldn't want to knock our testosterone level down to zero. And in men, their main sex hormone is going to be testosterone, but estrogen also plays an incredible role. Now, for those who use way higher the doses of testosterone than would be medically recommended, oftentimes they take other medications to counteract the estrogenic side effects. In the man, that person gets their estrogen from its conversion from testosterone. So when you drive up those testosterone levels, more of that testosterone will get converted to estrogen. And high estrogen levels can be very bothersome and can cause a lot of bothersome side effects, including fluid retention, mood changes, breast tenderness, breast swelling. So those are some of the reasons why people will take anti-estrogens or aromatase inhibitors, because their estrogen level is so high.
So Amy, what is the data though on foods that can increase estrogen levels? So is it true that eating soy products increases estrogen levels? What are your thoughts on that?
And it's not true. So they've looked at that. There's great research out there showing that things like tofu and soy products do not increase estrogen levels. So, in general, what is good for our heart, what is good for our blood vessels, what is good for our body is going to be good for our hormones. And more research is coming out now, and you may want to touch on this a little bit in terms of the importance of plant-based diets.
Exactly. Well, I just wanted to go into soy products are a phytoestrogen, so it does not increase your blood estrogen levels. And so that's a big one. But yes, the plant-based diet, anti-inflammatory foods are incredibly important, because when we talk about the penis, when we talk about hormones and kind of our end organs, what we're eating plays a critical role in the blood flow and nerve function of those organs. Now, there is one caveat that we use the term plant-based all the time. Plant-based does not equate to healthy. A lot of the products out on the market, a lot of the products that contribute to obesity, cookies and cakes and things like that, are technically plant-based. They are wheat or flour-based products. So just be very cognizant of the fact that plant-based does not mean healthy. It is a sexy term to try to entice you to eat that product. Whole food plant-based is really what we're talking about.
Wow. Okay. Knowledge drop right there. Thank you for clarifying that for sure. Okay. So then let's go into some of the other controversies around testosterone. And there are three main topics where there have been controversy regarding this therapy. So one is regarding its impact on cardiovascular health. Two is on prostate cancer. And the third is on fertility. So let's tackle that last one first, fertility. Some people think that if they have low testosterone, then taking testosterone therapy will improve their fertility. That is completely wrong. So what the body sees when you take testosterone from the outside, testosterone therapy, it tells the brain, hey brain, we're good. We're going to shut down production. And so the brain stops sending signals to the testicles to produce testosterone. This is really key for those people who go to shot clinics or men's health clinics in the community, is they're incentivized to put whomever on testosterone therapy who walks in their door, and they may not ask that man, are you currently interested in fertility? Are you interested in future fertility? That is really important to keep in mind. So for guys who come in with low testosterone, it doesn't mean we can't treat them. We have other tools in our toolbox that can potentially raise their testosterone levels. And we always want to consider that safety measure of, might this person want to bank sperm or freeze sperm, what we call cryopreservation, before starting testosterone therapy, as a safety mechanism. The other thing that we'll consider in guys who, let's say, want to be on testosterone but are not interested right now in having a child, but are considering maybe at some point in the future I may have one, is we always want to keep up some stimulation to the testicles. That's where medication like HCG, human chorionic gonadotropin, can be incredibly important. We put patients on that about once a week or so to keep up some stimulation to the testicles. The other point to keep in mind is, just because you're on testosterone therapy, that's not a contraception. So plenty of people can have children while on testosterone, but the wrong thing to do for someone who's currently or interested in future fertility is to tell that person, oh, your testosterone level is low, let's put you on testosterone, and that will improve your ability to have a child. That is the wrong answer. All right, let's tackle controversy number 2 when it comes to prostate cancer. We used to think that putting guys on testosterone therapy would increase risk of prostate cancer coming back in those who were diagnosed with prostate cancer and then treated for prostate cancer. That has not panned out in terms of the recent literature. Lots of research has been done over the last 5 to 10 years to show that that is simply not the case. What we know is that testosterone therapy does not increase risk for prostate cancer developing. What we also know is for guys who were treated for prostate cancer with, let's say, surgical removal of the prostate or radiation, that in general, it's going to be a safe therapy once they have been treated for prostate cancer to put them on. We don't know the timing, so there's not a lot of guidance in terms of when it might be safe to start someone on testosterone, and that's where that shared decision-making model is really important when we're talking to patients. We do want to see that PSA level after their prostate has been treated, and then everyone has their own comfort level. So it might be 3 months out, depending on what their pathology was for prostate cancer in terms of starting. And other people may say, look, let's wait a year, let's wait 2 years, and then we consider, starting testosterone therapy.
Does testosterone therapy, does it increase PSA at all or alter it? Like, would it then influence what you think if the PSA is slowly increasing, but you started someone on testosterone? Do you blame it on the testosterone?
So great question. And we do expect for guys who have low testosterone, we do anticipate that their PSA will go up a bit because the prostate is a hormone sensitive organ. So that's actually where, you know, if I see a guy where his PSA is, let's say, well within the normal range or at the high of the normal range, and he has low testosterone, when I put him on, let's say, testosterone therapy, his PSA may then be high. And that's actually going to then prompt a workup for elevated PSA because that person may actually have prostate cancer that we missed because his testosterone level was low. So the prostate is a hormone sensitive organ, and we definitely need to keep that in mind. So guys, if their PSA is rapidly increasing on several occasions once we start them on testosterone, that might be a reason that we hold that testosterone for a period of time and actually work them up for something like prostate cancer.
But would you do a workup if the patient's PSA was borderline high and they had a low testosterone? Would you do the workup before starting testosterone?
Yeah, great question. And in some guys, yes. It depends on their age and if they're within, you know, if they're interested in having that done. But these days, we can get prostate MRIs on a lot of people, even in the absence of no prior biopsy. So for the guys who are sort of on that cusp, I oftentimes get a prostate MRI just to give some good or better images of the prostate. Now, a prostate MRI doesn't mean that that person doesn't have prostate cancer. And same thing that if a person has a prostate MRI and it shows a lesion that is suspicious for prostate cancer, the only way to really diagnose prostate cancer is to get a biopsy. But it can help us get all the information up front to make more educated decisions.
But if you order an MRI of the prostate, how do you bill that if the person's PSA is technically normal? Is it covered by insurance often?
It's going to, it'll depend. It's rare that I actually run into issues. I'm lucky in the state of Iowa where I oftentimes don't run into issues. But yeah, other places, and depending on the insurance company, it could be problematic. I'll usually, you know, put in there a rising PSA. So it definitely does depend. And then the third one is going to be heart disease. So there were articles that were published in big journals a couple of years ago, New England Journal, JAMA, that said that testosterone therapy, you know, increased risk of cardiovascular events. And the problem with those studies is they were never properly designed to look for cardiovascular events. And so they were incredibly problematic. So what we know in terms of low testosterone is low testosterone is a risk factor for heart disease. We don't know whether putting someone on testosterone therapy increases or decreases that risk, with the caveat that more and more research is coming out now that looks at blood pressure control and glucose control and waist circumference, and all these factors that are associated with metabolic syndrome and heart disease, and showing that for men with low testosterone, when you treat their low testosterone, those factors can improve. So more and more research is coming out to say that when safely done, men with low testosterone, you treat it, it can impact all of these factors related to health and heart disease. So the jury is still out, but in general, for guys who come in with low T and we start them on therapy, they are some of the happiest people that I see. I'll give you an example. About a couple weeks ago, I had a guy come in, probably mid-30s or so. And the first time I had seen him was about 3 months ago, and we were changing around his testosterone therapy a little bit for more frequent dosing. So once a week testosterone injections. So when he came in for his first follow-up, I said, "Hey man, how you doing?" And he said, "Dr. Pearlman, I'm living my best life." And I'm always interested to hear, in terms of any therapies that I recommend, even if it's lifestyle modification, in what ways do you feel like your symptoms have gotten better, have gotten worse, or haven't changed, just for my own insight, so I can then use that information to talk to my other patients and other people in the community. And he said, "I'm sleeping better. When I go to the gym and I work out, I actually see changes in my body, whereas before, despite working out, I wouldn't see those changes. I'm not anxious. My sex drive is great. My erections are great. And I feel awesome. And I don't want to change what we're currently doing." So not to say, and this is where counseling different types of people is super critical, testosterone therapy is not going to be a game changer for everyone. In fact, research suggests that the more medical problems and comorbid conditions that someone has, they're not going to notice as many benefits when it comes to treating their low testosterone. So those guys who have other medical problems might report some improvements in energy, some improvements in erectile function or sex drive. What I find though is the guys who come in who are younger, who are relatively healthy, who are doing all the things, who are doing all the lifestyle changes. They're working out, they're doing their best with nutrition, and they have low testosterone. Those tend to be the guys that are high-fiving me in the office and who really benefit from low testosterone treatment.
All right, well, let's wrap things up here. Thank you so much for those knowledge bombs and kind of getting rid of a lot of these myths out there when it comes to testosterone replacement and how it may or may not be a game changer, but it can certainly be helpful if done in a safe environment and monitored and done appropriately, and how testosterone replacement is not the same as anabolic steroids.
Yeah, when done safely, testosterone therapy for men with low testosterone is incredible therapy. And we must acknowledge the importance of hormones in people of all genders. In women, estrogen, in men, testosterone. And in order for people to optimize not even just their genital health or their sex drive, to optimize bone health and heart health and overall well-being, we must address the aspect of hormones.
All right, love it. Have a wonderful Sunday, everyone. Thanks for joining.
That's all, folks. I'm Amy Pearlman.
And I'm Michelle Pearlman. Thank you for tuning in.
We'll see you next time.